All right, so Ralph Havens, physical therapist, and Tom Giammatteo, physical therapist, chiropractor, naturopath, integrative manual therapy, developer of integrative manual therapy. And we're here to talk about something that seems simple, but is still stopping you from running. It's knee pain that won't go away, and or hamstring strains and pains that won't go away. And it pertains to other running type injuries or even walking injuries, stuff that stops you from doing what you want to do in life. So I'm going to open it up to Dr. Tom Giammatteo. And just to let you know, I've taken 114 classes from him and his group in integrated manual therapy. It's a medical intuitive model to fix up, to change the structure to improve your health and your performance. And I use it for my son before his running races. And so, Tom, I'm so glad you're here. And
thanks, Ralph.
Thank you. And anything that you want to say about yourself first, and we could also just jump right into like this idea of like I'm always running into runners, especially, but also walkers that just can't do what they want to do, which is walk and run. And it's seems simple, a knee pain, and nobody seems to have answers, or a hamstring strain. There's lots of other ones too. But what's your thoughts on that?
Well, doing lots of sports medicine. I was a physician in 1996 Olympics, and working with that group, and also working with special need groups of spinal cords and helping people learn to walk again. There's a lot of dynamics in the foot. So first step is, how often are you changing your running shoes, right? And it's recommended between 2 and 3 months. The wear and tear on running shoes is ridiculous. Runner's World used to state the wear and tear, and they were so short they had to take that out of their magazines because all their sponsors, Nike and Reebok and all those guys, didn't want to tell consumers how much the structure of the shoe does change over time.
Yeah.
Right? So if you're putting in 5 or 10 miles a week, it is a 3-month window to start to get your shoes working better. But running pains could be everything from a simple changing your shoes, or are you running on the sidewalk with the concrete, or you're running on the road with a little cornice to the road, and that stresses out the legs. And then it could be other issues. Are your muscles getting enough rest? Do they need to be rehabilitated and retuned? Do you have enough flexibility? Can you are you able to put your feet against the wall and your butt against the wall and reach down and touch your toes without falling forward? That's unflexibility and not being flexible enough. And so if you're running on tight, strained muscles, that can also irritate that whole pattern, right? So, and we do an individual approach where you watch the person run, and you're seeing if they actually have the great biomechanics of the foot. Is their heel striking? Are they rolling on the outside portion of the foot and then coming over and pushing off their toe? Do you do a heel strike 4-foot run, or do you do a barefoot run where your heel barely touches the ground? All those things are multiple variables, and people just like to throw on shoes these days and just jump out there and do it. Are you wearing Crocs 90% of the time and then jumping into a running shoe? The foot posture of our now generation is more flat-footed, and we've studied hundreds of different biomechanics, and we have a wonderful team with Soul Supports, which makes our orthotics, that we can improve the potential and well-being of many runners. The U.S. Army and the military are using them in their shoes when they're teaching recruits how to march. Some military bases, every new cadet gets 3 new pairs a year just to do their marching and their physical therapy processes and those pieces. That's how important the foot is. But we really don't take care of it. We throw it in Crocs, we throw it in sand, the little sandals, and we have to take care of our arches.
That's awesome. Yeah, when I first got my Soul Supports, the orthotics, I felt like I was cheating because I was like springing, and my stride length was different, and my frequency was better. And it was like, now they're talking, we have all these shoes with carbon plates that spring you forward. I want to talk to Dr. Ed Glazier at some point and just see what he thinks of the carbon plate technology. But yeah, the Soul Supports has that spring-loaded arch thing.
And sole supports was the originator of keeping an arch, a super arch in the foot. And it's custom made where, you know, the spring in the bottom of the sole of the shoe is a great idea, but it's not specific for your body and your type.
And that's what I noticed with running, like with the shoes, there's so many, it's like a renaissance of shoe technology now. And these things called super shoes. And when you put them on, like I watch my wife or my son run and we test different shoes and they get the shoes that feel right for them. And you watch them run now more than ever than even in the old days. A shoe could make somebody look really bad, or it could make somebody look really good, or like the shoe's not doing anything out of the ordinary to the normal foot strike. So it really is quite different just putting a pair of shoes on and how it feels to go out there. So I'm taking notes. So new shoes, the surfaces, are you on hard concrete or trails? Is it tilted? How's your are you getting enough rest? I see that with a lot of runners. They just train too hard and they don't take rest and they don't have a plan. And if you don't know who Jack Daniels PhD is, you should get his book Running Formula. But he talks about most runners are just running their easy runs too hard. And then they don't, then they try to run their hard runs too hard, and then they're just tired and they get beat up. So that, and then the football mechanics, and what are you wearing when you're not running your casual shoes, and this whole idea of the arch and the sole supports, and then you have a structural approach, a hands-on approach to take somebody and individually look. When you think of stuff that's just chronic, you know, these things could help somebody that has a knee pain that's not going away. You get them in sole supports and the knee pain goes away. Yep. Or you know, you just give them enough rest. I see so many runners, especially all sorts of runners, some with coaches that are pretty good, but they're overcooking them a bit, like just too many miles too hard. What about the someone comes to see you with a knee pain that's not going away, and you're putting these things in place, and how do you approach it when you put your hands on somebody and go look to how can you help somebody?
A few other things is that when somebody comes in, we look at their posture from head to toe. We look to see if, you know, it's called knock-kneed, when the knees touch and the feet are flared out a little bit. And then we have other people that have your hip should be under your hip, your knee, and your ankle should all be in alignment, which would be perfect. And even they complain that females, because they have wider hips, the knees should come in a bit. That's really not true, right? If we go back even 6,000 years ago, the Western medicine knows it as acupuncture, but it is traditional Chinese medicine, and it's the philosophies of that I find that in the United States is demonstrated in foot posture per se. So the kidney meridian of the foot, here's my little foot demo here, sits right under the spot here and travels down and inside the ankle and rolls around and comes all the way up to our collarbones. The kidney meridian also incorporates the adrenal system. So adrenals are about stress and support. And when we have a fatigued adrenal system, our feet roll in and become more pronated and flat-footed.
Isn't that wild? I wanted to say that again, like, so flat feet, look at the adrenals. Interesting, huh?
Basically, take some stress, do some meditation. We have some great adrenal support herbs. One is called ashwagandha. We have another one that's a energetic medicine, which we call fields of flowers. I just wanted to show you two feet here. This is a flat foot, and this is a plantar, and this is a natural curve in the foot. And so if we hold them this way, you can see that the flat foot is much wider in the whole process, okay? And so we waste a lot of energy when we're walking on the flat foot, and the ground gets harder because we've lost the spring mechanism over here, okay? And this can cause plantar fasciitis, shin splints, another one called Osgood Slaughter, all could be because of the foot posture. And when we're doing our diagnostics, Ralph, of looking for adrenal stress, the blood test is for cortisol. A functional test, if people want to try to do this, and it was described in 1910 by a Dr. Ragland, and it's called the Ragland sign, Ragland, Dr. Ragland, is that our blood pressure taken in 3 different positions should go up as we move through the positions. So if you lie down for 2 minutes and you have an automatic blood pressure cuff and you take your blood pressure and then you go to sit up, it should actually jump 10 points. And then you take it again, when you get to standing, it should jump another 10 points. So if you had a blood pressure of 110, when you sit up, it should go to 120. And then when you stand up, it goes to 130. And after you stand there for a few minutes, it goes back down to 110 as the body recalibrates, because we need more blood pressure to get the blood to our brain. And
So
that is all.
what's the lag time? Like you go from laying down to sitting up, and how long do you wait before you take your blood pressure when you sit up?
Immediately when you sit up.
Okay, got it.
And another minute later, you do immediately stand up. And then if you go to standing and wait 3 minutes, the blood pressure should drop down. So you're taking 4 readings.
Okay, that's awesome. I'm going to check that today.
So there's a new venture word out in the medical literature, which is called POTS, postural orthostatic hypertension. Okay. And in the medical world, if your blood pressure doesn't go up and drops 10 points in any one of those, that is almost a medical state of that's when people get dizzy and fall down. Right. So we evaluate everybody before that, so we actually see where their adrenals sit. And as we help them get their adrenal better is by changing their diet, so they're having adrenal stress food, which happens to be like sugar and gluten and some anaphylaxis to peanuts and almonds. We get those out, that strengthens the body. And then everybody nowadays is into oat milk and almond milk, and I'm saying stay away from those poisons.
Yeah.
Okay. So we really believe that the kidney, meridian, and the adrenals are the soul of the feet.
Or the what? The sole of the feet. Okay.
Are the soul of the feet. They are the muscles of the feet. And if you go back into Chinese literature, and you look up the muscle meridians of the acupuncture, you'll see that the posterior tibialis, which makes this arch over here, is influenced by the kidney meridian. So when that's stressed out, this collapses. And you get a foot that looks like this, flat. And you can notice in this is the healthy foot. The toes are directly under the ball of the feet. And here in the flat foot, when it flattens out, you actually get a bunion.
Yeah.
Okay, because when the foot gets flat, the bone has to go somewhere and it twists the toe out. So anybody that has a candidate for a bunionectomy is really, truly adrenal stressed.
Isn't that interesting?
Who wants to really hear that?
Yeah, because it sounds like a lot of work to fix this.
Well, it's a health change because we're on our phones too much. We're looking at computer screens. We're rushing to the next thing. We don't really eat good food for ourselves. Yeah,
so the food, the space that you give yourself. I did go into our little boy's karate class because I showed up at the very end just because of the schedule, and all the mom, not all of them, but most of them were doing this the whole time, and they had little smiles on their faces, like they were so happy to be typing on something. I'm like, wow, your kids are playing karate right now. But
right. Should be watching it, right?
Yeah. But okay, so this is interesting. And so when you think of chronic problems like knee and hamstring, you're looking at the foot, you're looking at the posture, you're looking at the whole body, the whole system. Anything else when you think of like people come in like, I can't run anymore, the knee, or
yeah. Well, it's a whole chain, right? From the big toe and the little toe all the way up the ankle, through the knee, through the hip, through the pelvis, and then back down the other side. So that's the weakness of the foot, right?
Yeah.
And then we have the tracking of the knee. If your hips are not, if your ankles and your knees and your hips aren't straight, boy or girl, then we know we have sort of that collapse of the adrenal system, and we sort of support the arches at that point. So if your leg and knee are in alignment with your ankle, then we don't have all the knee pain because the quadriceps, the front muscles, are working well. It also tells us the balance of the hamstrings in the back. So as you move up in the hip joints, are you flexible enough? Do you have a tight psoas muscle, or is it a sacrum problem? Okay, I remember I had a bunch of runners, and one woman came in with, they call it SI pain or back hip pain, and I went through the biomechanics. And she, on her marathon, she was maybe on her 20th marathon. We dropped 20 minutes because we got the biomechanics of the pelvis opened for her.
That's so cool.
Right.
Yeah.
And then it's looking at, do your muscles have enough energy or fuel to run and coordinate the right way?
This is so cool. I'm taking
Yeah.
all of these notes and I'm going to stick them in the description as a framework with your link, imtwellnesscenter.com, Dr. Tom Giammatteo, and then my link, ralphhavens.com, and reach out to us if you've got a knee pain, a hamstring pain, some sort of like thing that's stopping you from running and biking and walking and doing what you want to do. And it does sound maybe a little bit like, wow, that's a lot of stuff to look at. But for you, Tom, it's systematic. Like you can find where somebody's glitches. Is somebody
So this is a checklist, just like when you go get your car tuned up. Are your tires have the right amount of air in them? Do the tire alignments go that way? But it's not everybody has every single one of those. They have, out of the 20 that we discussed very briefly each, there's one or two that throws that car out of alignment.
Yeah, and you get that right, and then you get back to running or walking.
Yeah. So like there's a advertisements, the Good Feet store, and they're just doing orthotics. And they may rescue the lower 30% of it because it is the arch that needs to be supported. And all the other people come in and complaining, well, that thing didn't do anything, it cost me $800.
Yeah.
If you look back at the long run. So a visit and evaluation from your group on your West Coast and my group over here may be useful.
Yeah. Yeah. Where's your thing? Where's your glitch? Where's the thing that's not?
And to pick that out, so you don't have to waste your time on supplements. Do you use like glucosamine and chondroitin to fix your knee pain? When it's really fix your gut, and then all that takes care of itself. Or do you put orthotics in and it takes the stress off the GI pieces?
Yeah, and we haven't even talked about some of the joint and connective tissue techniques that you have, that we have, that you've taught me, the helix biomechanics and the RRR, relax, relief, release technique. There's all sorts of manual techniques to restore function, structure and function in the foot and up the back and the spine and that. So I'll put links to that too. This is awesome. What a great checklist. And yeah, anything else that you want to say about for runners? Some people just have lost quite a bit of hope. You know, I know somebody that has a back pain that is stopping him from running, and I say, hey, come on over to me. Let's see if we can fix this up. And he just has this like, there's nothing that can be done. The doctors say it's this, and and then knee pain. So many people have just given up. I guess I'm talking to people that have a little bit of hope, that want to go see, can they get back to their sport or their running. So I'm putting it out there for you guys. IMTwellnesscenter.com and my site, ralphhavens.com. Yeah, Tom, it's so good to know you. I was talking to somebody in the insurance world this week, and they're like, well, do you have a doctor? And I'm like, well, actually my doctor's on the East Coast. I have a system that we use, and between you and me, we keep my family healthy and good. So, and that's one of the nice things about this too, is Tom and I can talk to each other about people. If I have somebody that's got something going on, Tom's who I reach out to for my family. So highly encourage you to talk to him. He has people from all over the world that come see him in West Hartford, Connecticut. And now I'm starting to get people from all over the place coming to see me. So and we do things over the phone and internet too. So I'm putting it out there for you guys. If you need some help, call us, message us. Tom, anything else before we sign off? And I think that feels really good. I'm going to make this a nice checklist in the description. So look for that. And I'll put this everywhere in our YouTube and Rumble and Spotify, and share it as you can. All right, you guys, let's get out there and live, really live.